Number 4, Rosabel Young, going solo. Rosabel Young, going solo.
Can you all hear me? Going solo. No, I don't mean in an airplane. But when I was starting my solo medical practice, sometimes it felt like I was flying by the seat of my pants.
I can't hear you, I really can't.
Oh, okay. Thank
And I
you.
would love for you.
Thank you. Thank you. Well, fellow Toastmasters and distinguished guests, how many of you had to borrow money for your education? Or your children borrowed money? Lots of you. Well, when I finished my medical education and college and everything piling up, I was in so much student debt, I couldn't even afford to rent an office. Luckily, a nice hospital administrator let me have one of the rooms in the hospital to use as my office. It was the telephone closet. A little 5 by 5 foot room with wires hanging on the walls. And just barely enough room for me to fit one of those folding TV dinner trays from Walmart to use as my desk. I spent a lot of time at the hospital, but would return to the office whenever the telephone repairman came by. And I learned a lot from him. It helped me get my internet set up, and that was back in the early 90s, when it would have been very expensive and definitely beyond my reach. At the hospital, we would get together for lunch at the hospital cafeteria with the other doctors. But one day, at the entrance, it was blocked off by a big yellow tape that said, "Caution, do not enter." And I asked the medical director, Dr. Thompson, what happened? And he said, "Rosabel," and everybody else who was listening intently, the county health department closed the hospital cafeteria because of vermin in the kitchen. They can't serve in the cafeteria anymore. And I said, "Oh, yuck, cockroaches." He said, "No, rats." I thought, "Oh, yuck." But I looked through this little glass window in the door, and I could see people back there cooking and working like they were in the kitchen, with steam coming up and plates clanking and everything. And I said, "Well, Dr. Thompson," he said, "Well, let me explain. The county health department can close the outpatient cafeteria, but the hospital food preparation for the patients upstairs is under Jacob, and they only do inspections every 5 years." Fearing that my patients were going to have rats for lunch, I ran upstairs really quickly and started making sure my patients were okay. "Mrs. Smith, how are you feeling today?" "Oh, doctor, I'm still sick. I have no appetite." "Good. Let's take you home today. See you there." And that's how I started making house calls, with my little black bag and going door to door like the old-fashioned way. And the nurses at the hospital helped me. Some of them even started home health agencies. This was the mid-1990s, when healthcare was moving away from expensive hospital care to more home-centered and outpatient care. The timing was perfect. I was lucky. And I really enjoyed making house calls. I got to know the patients, their families, their home setting. One day, a family called me to see their mom. She was elderly. The hospital had sent her home, supposedly with terminal Alzheimer's. They had given up on her, but the family wanted to hear just one more chance, if there was anything that could be done for their mom and grandma. I went to the house and found the old lady lying on the couch with her eyes closed, not even responding to her name. The TV was on. So I thought, well, I'll turn it off so there's some quiet, maybe she's trying to mumble. I grabbed the remote control and click, click, click. But instead of turning it off, I must have been pushing the wrong button because it just changed the channel. And then suddenly I hear, "It's Cab Calloway." I look, and the old lady is sitting up with a big smile on her face, clapping and singing with the famous jazz singer on television. Well, hearing all the commotion, the family comes back in and says, "Doctor, you saved our mama. You're a miracle worker." And I'm like, "Who, me?" Well, it turned out that the lady actually had more depression, not really dementia. And she revived upon hearing old familiar songs and happy music. It was really mind-boggling how easy a solution could be when you really help somebody on their terms, at their level. I continued making house calls and also did telemedicine because I had some patients who were living too far away for me to make the house call and they didn't have money to come and see me. For example, Canadian hockey players with sports concussions that were not retired and getting dementia, or NFL football players, mostly living on the East Coast. So I also had to see them by telemedicine. Back then, sports concussion wasn't a recognized diagnosis. This was still the late 1990s. And telemedicine was not an acceptable method of care. That means insurance didn't cover anything. Patients had to pay out of pocket or couldn't pay me at all. But I still saw them. And eventually, sports concussion became recognized as chronic traumatic encephalopathy. And we all know during COVID, we all needed to see our doctor on telemedicine. And it was lucky that telemedicine was there. So my practice became really, really busy, but I enjoyed it. One day I saw a retired football player who was now an insurance agent. And on telemedicine, I followed my routine. He'd take off his shoes, his socks, and his shirt. And suddenly I noticed 3 young ladies looking through the glass wall. And I realized this guy's in his office. I apologized profusely, and he said, "Oh, that's okay, doctor. At least you didn't have to take off my pants, because they'd be calling the police right now." Well, going solo was not easy. But I stayed on my flight path, stayed on course, because I looked at the positive. And when challenged by changes, they became an opportunity to learn something new, to do something better for my patients. I hope that you will all follow that. And I'm sure if you look back at your lives, you'll have similar examples.